Hi, I'm Dr. Ahmed Jelani, consultant orthopedic and joint replacement surgeon at VSH Hospital, Bangalore. Today I'll be talking to you about osteoarthritis of the knee and knee replacement surgery. Many people suffer from severe knee pain due to wear and tear in the knee as they get older. When knee pain becomes constant, walking becomes difficult. Simple activities like climbing stairs, getting up from a chair are painful. These are signs of osteoarthritis of the knee. Knee replacement surgery is a safe and effective option when other options like medication, physiotherapy, and other treatments no longer help. In this surgery, we replace the damaged part of your knee with specialized implants with smooth surface which will decrease your pain and increase your mobility. This surgery is usually recommended for people above the age of 60 years, but those younger patients with damaged knees, it is also beneficial. If knee pain is affecting your quality of life, making sleep difficult and limiting your independence, please consult a joint replacement surgeon. Thank you.